Big challenges coming up for everyone who wants to go out but yet tries to understand कि यार करे तो कैसे करे, because whenever you are going out you are exposing yourself to not just the viruses that are in the air but also to the people who are carrying them. They may not look like that they're carrying it, but if they are, you're welcoming them खुले हाथों से. नाउ फ्लू की तो एक बात डेफिनेटली हो ही गई, साथ ही साथ बातें हो रही है अबाउट कंजक्टिवाइटिस ऑल्सो. सीरियसली we'll talk about that right here on TSB.
TSB, Talk Sport and Business. Talk 100.3.
So now red eye cases have doubled. Viral conjunctivitis is driving longer recovery cycles, and hospitals across the UAE are reporting a sharp rise in red eye infections, with doctors actually pointing at contagious viral conjunctivitis which is spreading in crowded and shared spaces. So चाहे आप malls में जा रहे हो, चाहे फिर आप कोई restaurants में जा रहे हो, schools में बच्चे जा रहे हैं, तो भी थोड़ा सा ध्यान देना पड़ेगा. And you know, the doctors who take care of your eyes, they are in fact keeping a tab on everything and they're telling you to be extremely cautious. So we thought, why not? We speak to someone who is in that industry, is a specialist, and works with your eye, ensures that your eyes are taken care really well. We've been joined by Dr. Arif Adenwala. He's a specialist in ophthalmology, joining us to talk about what is happening in the UAE. Dr. Arif, thank you so much for joining us today on TSB.
Hello, hi, and thanks for welcoming me. Right now, we have seen I hope everybody will be enjoying the weather, but at the same time, because of the extreme coldness, the chances of getting infection and conjunctivitis have really increased.
So, when you say conjunctivitis, what is conjunctivitis and how different is it from a regular red eye?
Yeah, basically, it's just the infection which spreads because of the change in the weather, dust, where the eyes become red, swollen. You will have some stickiness. You will have some foreign body irritation, foreign body sensations. And sometimes if this infection stays for a long time, then your vision will get blurred. And this is contagious to a large extent. It's not like a normal allergic conjunctivitis. But if there is any secondary infection or a secondary virus, then it can spread to people around.
So, you know, बचपन में जब ऐसा होता था तो हम कहते थे कि आँख आई है. I mean, have you heard of that term as well, sir?
Yeah, exactly. So it is something similar. It is usually seen in the Middle East in more of the humid climate, July, August, and even in the extreme cold weather, this is quite common. And what precautions we need to take while in case of red eye is always keep your hands clean. Don't keep touching your eyes,
okay,
so that it can spread. And when you're going to work, don't touch your eyes and don't touch to the common places where there is always a chance. Wear sunglasses outside because to prevent just the dust or extreme humidity or sun, you have to take care and keep putting the drops to control your infection. And if possible, try to be at home. Take sick leave, be at home so that the acute phase you're not spreading it to someone at work.
This is very good. You know, okay, if you have got the condition, though, you stay at home, and if you don't like your boss, go and meet him.
It's better, someone. So it's always better, and usually what we have seen it in the night time, the chance of getting the acute stage is more common.
Okay.
So even if you feel some sensation and all, try to visit the doctor and try to start the medications. And reduce your screen time because the screen time also causes more of these pain, irritation, and increase in the infection.
Wow, you've connected two big problems. One is a seasonal problem, and one is a generational problem now, and that is the usage of screen. But doctors, tell me, you know, when you talk about red eye and conjunctivitis, is it more to do with kids or are adults as equally affected?
This conjunctivitis is affecting all ages because the screen usage is there with all ages. Plus, the school kids, they go to the school, there is always chance of getting infection from the surrounding kids and even at workplaces. So this affects all age group.
And there's no way to prevent it. Like today, I don't have it, but now that you mentioned, I will be extremely cautious before touching my eyes. But are there any other methods to prevent it?
You have to just reduce your screen time and take care of the hygiene. That is the most important thing, and that's the thing which can prevent it. And if your immunity is good, then the chances of you getting this infections becomes less.
Now, how dangerous is it? Is it something that will come and go if you take proper medical care, or it could get into some complications as well?
Maximum cases, if it's early diagnosed and treated, the infection usually subsides. It has its own acute phase where the infection goes up and for a couple of days and then goes down. But if it is not treated properly or if your immunity is less, the virus is very strong, then your round part of the eye, that is the cornea, which gets affected. If that gets affected, then it will take few weeks to subside.
Okay, but then it does not negatively impact your eyesight in the long run.
Usually no, until you have severe uncontrolled diabetes or infection is really bad, immunity is very less, then yes.
Hmm.
But maximum cases it doesn't. Long-term complications are not there.
So, you mentioned diabetes. What is the connection of diabetes and eyesight? I mean, diabetes has got everything to do with insulin resistance and high blood sugar levels. But what has that
Uh,
got to do with affecting the eyes?
yeah, the diabetes usually affects all parts of the body. The common cause of blindness is the diabetic eye disease, where the central part of the eye, the behind the back side of the eye gets affected, and there, if not diagnosed at the earliest stage, it can lead to blindness. So we recommend all diabetic patients to get at least one checkup of your eyes, and then accordingly, based on how bad is your retina involvement or the eye involvement, the doctor is going to tell you when to have the checkup.
And
But
and
diabetes is affects everything.
and this is specifically for diabetic patients. But apart from diabetic patients, how often should one actually go to, an ophthalmologist like yourself to get their eyes checked? And what should they
Okay,
be
now
checking for?
yeah. So if you're using the screen time regularly, then you need to take first precautions. And in case if there is any headache or strain, you're not able to see clearly and all, then you should get your eyes checked. Maybe you need the glasses.
Hmm.
Or in case of kids, if they are not able, I usually advise the kids to sit at the last bench and try to see if they can see the whiteboard.
Okay.
And if they're not, then they should get the checkup done at least once in a year. Or those who have got the age more than 40, then you should get their eye pressure checked.
Okay.
And all diabetic patients should get at least one checkup done.
There has been a lot of conversation about LASIK and such surgeries for correction of the vision. What are your thoughts on such procedures?
Yeah, so right now with the latest advances in the diagnostic method and the treatment, the success rate is very good.
Hmm.
Now, the main thing we are able to diagnose and detect which cases should not be done
Okay.
because the diagnosis has become very good. It's a safe procedure. Now, with the recent method known as ProSmile, the cut on the cornea, the time taken has dramatically reduced. Within 10 seconds, you can get your laser correction done for each eye.
Wow.
And it has really changed. There's no pain, no injection, no needle, and just 10 seconds, you are done with one eye.
Now, does this then correct both myopia and the other one?
Yeah, hypermetropia,
Hypermetropia.
astigmatism, myopia, even in old age people,
Hmm.
those who are like not old age, but those who are there more than 40, 45, 50 years, those who need reading glasses, now we can correct the glass numbers from all ages, right from 18 to 20 till 60, 65. All age group, the glass numbers of all sorts can be corrected.
This is such a blessing, because growing up, I used to wear glasses, and being someone who was extremely into sport, it used to be very, very challenging. I had to, adapt to wearing lenses very early in my age because for me it became difficult to wear glasses and when you're playing cricket and all of that.
Yeah, exactly. Yeah.
Right. But now when you are getting your eyes corrected, the lenses and everything goes away. You have, the LASIK is done. But then when the number 40 comes in, and that's what it's said, that once 40 turns up, then you require the reading glasses. Is there a different procedure for reading glasses for someone who's already been corrected for the other one?
Yeah, so once if you have got the LASIK done before 40, then you can always do a touch-up. The touch-up means a very minor procedure where you do laser settings and changes, and then you can correct your numbers. And those people who have not got the LASIK done, even they can do a type of LASIK which is known as Press Beyond, which is mainly indicated for people who are more than 40, 45, 50 years.
And
So there is a procedure for everybody, even if you have got the LASIK done before.
Uh-huh.
provided your cornea test, your measurements, your thickness, everything should be normal. Then you are fit to go.
This is so amazing. The medical science that has come through has just, blown our minds. I don't know if anyone would have thought of getting rid of their glasses in such a fashion that, like you mentioned, that 10 seconds per eye and you're done
Exactly.
with. But
And really, matlab, the people who are having power of -6, -7, -8, the next day, even the same day evening, they can see the time on the watch and everything. It's like a second eye.
it's beautiful. I mean, I've gone through LASIK myself, and I can tell you one thing, that
Right.
it is life changing for me, for someone who was dependent on lenses for a major part of my life.
Yeah.
LASIK definitely has been life changing. But is there? I mean, I'm sure in your experience you would be coming across a lot of people who have the fear of going under the knife or going under the laser because it's your eye.
Yeah. So we try to spend maximum time before counseling the patient, explain to them about the procedure. And
Hmm.
some patients who are very apprehensive, we give them a mild the sedatives, or not sedative actually, just to relax them
Okay.
before the procedure and explain to them that you don't have to worry. It is just 10 seconds. The main people are worried is about the blade and the cutting. So we
Right.
don't, and injections. So there is no injection, no pain, no blood, blades, nothing. So once the proper counseling, explain to them, relaxing them, talking with them during the procedure, because
Hmm.
that anesthesia, that type of anesthesia where we are talking with the patient constantly, they don't realize that 10 seconds is already over.
True, I agree with you, but do you think that social media also has to be blamed for this, for probably putting up videos? Because when I was planning to go for my LASIK, I saw some videos, and there was one video that actually showed how the lens is, the upper layer is cut and all of that, and I was,
Some are
believe me,
scared. So many people are just scared about
yeah.
what's going on, why you're cutting and all that stuff. But yeah, that is there. But sometimes it is a positive where patients are educated about it. But if you take it in a negative sense, yes, they are afraid that they don't want, because there are people who come here, they say, no way, I'm not going to let my eyes be cut. I'm
True.
happy with glasses. So it needs a good counseling actually.
I can totally imagine. But this is incredible. Now, from here to the next step, technology has definitely gone leaps and bounds from where it all started to where we are today. What are the next steps that we can experience or probably think of that could probably be there in the world of optics in the next, maybe say, 10, 20 years to come?
Yeah, there are so many cameras which are attached to the glasses, and that is also there in optics. And regarding the ophthalmology point of and that is also there in optics. And regarding the ophthalmology point of view, if you say there, AI also has started coming in ophthalmology,
Hmm.
where we can use the robotics, which will help us in doing our cataract surgery
Right.
and the steps. That is also already going on, but it is not actually came in the market. But that is the main thing where we can reduce the complication rate, increase the success rate, and also in complicated cases, often eye cases, we can use that.
This is incredible. In fact, there have been some movies, some science fiction movies, where we saw that people wear lens which have chips inside it, and they can
Yeah,
read through all of
exactly.
that.
Yeah,
You
yeah,
think
yeah.
that's
That is
that's that's
possible.
going to be a possibility?
Yes, yes, definitely. It is going to be there. We can have the chips
Wow.
in the glasses. Even the music is there. Sony has already come up with the glasses where you can have your
Yeah, I mean,
uh,
I have a pair of glasses, some glasses
yeah,
which are AI enabled and all of that.
yeah,
But
yeah.
but all of this without a physical structure on your face, just like contact lenses.
Yeah.
This is something which is completely unbelievable.
Yeah, really, it will change. Yeah, once it is there, readily available, it will change.
This is so amazing. Look at this. Our conversation started with viral conjunctivitis, and we have gone to talk about the future of ophthalmology and the way the world is changing, isn't it?
Definitely, definitely, definitely. It's really a best field. That's why I always enjoy practicing ophthalmology and the way advances have taken place.
Undoubtedly, and then especially for the most sensitive part of our body, that we have always been so
Yeah,
thankful
yeah.
to the Almighty, and thankful to the doctors like you who've taken care of our eyes like this. Thank you so
Sure,
much once
sure.
again.
Thank you. Thank you so much. Thank you so much. Have a nice evening.
Thank you so much. This is what a fantastic conversation this was. Talking about your eyes, talking on viral conjunctivitis, how to take care of yourself, and obviously the future of Ophthalmology. I had a conversation with Dr. Arif Adenwala. He's a specialist in ophthalmology, and what a fantastic person. He loves technology, he loves where the future is going, and definitely loves your eyes. I'm Neeloja. We'll take a quick short break and be right back on Talk 100.3.
TSB, Talk Sport and Business. Talk 100.3. Get ready for the ultimate Premier League showdown. Manchester City versus Manchester United on Saturday, 17th of January. The action kicks off 4:30.